Have you ever been jolted awake in the middle of the night by a sudden, sharp pain in your leg? Or maybe you felt your muscles tighten up during a workout, leaving you frozen in pain. If so, you're not alone. Muscle cramps are a universal experience, and today, we're here to break it all down. Hey everyone, welcome back to the Health Life Blueprint channel. If you're new here, make sure to hit that subscribe button and turn on notifications for more health and wellness tips. Today, we're diving into something almost everyone has dealt with: muscle cramps. Why do they happen? What should you look out for? And most importantly, how can you treat and prevent them? Stick around because we're covering it all. In this video, we'll go step by step through the causes of muscle cramps, the signs and symptoms, how they're diagnosed, and the best treatment options to keep those painful cramps at bay. Let's get started. But wait, before we begin, please subscribe to ensure that you never miss out on any of my essential stuff. Comment "I subscribe" below and I will personally welcome you to our community. With that said, let's get started. Let's start with the basics. What exactly is a muscle cramp? A muscle cramp is a sudden, involuntary contraction or spasm of one or more muscles. It can strike without warning and often causes intense, sharp pain. These cramps can last anywhere from a few seconds to several minutes and can occur in any muscle group, although they're most common in the legs, feet, and hands. Muscle cramps can happen in various situations. You might experience them during a workout, especially if you push your body too hard without proper preparation. They can also creep up at night while you're fast asleep, jolting you awake with an uncomfortable spasm. Surprisingly, cramps can even occur when you're simply sitting still for extended periods. Now, how common are they? Muscle cramps are incredibly common, affecting people of all ages and activity levels. Whether you're an athlete, a busy parent, or someone with a more sedentary lifestyle, chances are you've felt that unmistakable sting of a cramp at some point in your life. So, why do these painful spasms occur? Let's break it down. Primary causes. Dehydration, one of the most common culprits. When your body loses fluids through sweat or inadequate water intake, your muscles can become prone to cramping. Overuse of muscles, exercising too hard or for too long without giving your body time to rest can trigger cramps. Electrolyte imbalances. Low levels of key minerals like potassium, calcium, or magnesium can disrupt the delicate balance your muscles need to function properly. Secondary causes. Cramps can also stem from underlying medical issues, such as nerve compression or poor blood circulation, which can reduce oxygen flow to the muscles. Medications such as diuretics or statins, which may deplete essential electrolytes. Pregnancy-related cramps, often caused by hormonal changes and increased pressure on nerves and blood vessels. Here's a relatable example. Think back to a time when you were working out intensely on a hot day and suddenly felt a cramp in your calf. Chances are it was due to a combination of sweating out too many electrolytes and pushing your muscles too hard. Signs and symptoms of muscle cramps. How can you tell if you're experiencing a muscle cramp? The most obvious sign is sudden, sharp pain in the affected muscle. Alongside the pain, you may notice tightness or a hard, knot-like feeling where the cramp has struck. During a cramp, you may also have a temporary inability to use that muscle until the spasm subsides. While most cramps are harmless and resolve on their own, there are instances when you should be concerned. If your cramps are persistent, severe, or accompanied by swelling and redness, they could signal an underlying condition. In such cases, it's a good idea to seek medical advice. If your cramps are frequent or particularly bothersome, a doctor can help identify the cause. Diagnosis usually begins with a detailed medical history and a physical exam to pinpoint any potential triggers. Depending on the severity of your symptoms, additional tests may include blood tests to check for electrolyte imbalances or deficiencies, imaging tests such as MRI or ultrasound to rule out issues like nerve compression or vascular problems. It's crucial to consult a healthcare professional, especially if your cramps are interfering with daily life. They can help create a personalized treatment plan to address the root cause. Let's talk about solutions. Immediate relief stretching. Gently stretch the affected muscle to relax the spasm. Massaging, rubbing the muscle, can help release tension. Heat or ice, applying a warm compress can soothe tight muscles, while ice can reduce inflammation. Long-term treatment. To minimize the chances of future cramps, stay hydrated throughout the day, especially during physical activity. Maintain a balanced intake of electrolytes by including foods rich in potassium, calcium, and magnesium in your diet. Address any underlying medical conditions that may be contributing to the cramps. Preventative tips. Warm up before exercise. Prepping your muscles can help reduce the risk of cramping. Eat a balanced diet. Foods like bananas, spinach, and nuts are great sources of essential minerals. Avoid overexertion. Listen to your body and rest when needed. Here's a personal tip. If you feel a cramp coming on, try drinking a small glass of pickle juice. The sodium content can help stop the cramp quickly. It's an old trick used by athletes. By following these steps, you can significantly reduce the likelihood of muscle cramps and manage them effectively when they do occur. And there you have it. Everything you need to know about muscle cramps, from what they are to how you can treat and prevent them. Remember, staying hydrated, maintaining a balanced diet, and listening to your body are key to keeping those pesky cramps at bay. If you found this video helpful, don't forget to hit that like button, subscribe to the Healthy Life Blueprint channel, and share your thoughts or go-to remedies for muscle cramps in the comments below. With that said, thanks for watching, and until next time, take care and stay healthy.